Good evening. My name is Jamie Neal. We'll be talking to you today about gestational diabetes, the timing of gestational diabetes testing of mothers and infants. I would like to share if you'll give me a moment, I'll go ahead and share my screen with you. Here we go. All right. Early glucose tolerance testing and the outcomes of gestational diabetic mothers and infants. There's a lot of discussion, a little bit of discussion about diabetes and the timing of testing. Today, we'll talk about the effects of the timing of testing and how it has effects on the mothers and infants, gestational diabetic mothers. First, we want to talk about the definition of gestational diabetes, defined as insulin resistance in pregnancy. It is developed during pregnancy. Sometimes people get tested during pregnancy and they find that they maybe had pre-gestational diabetes, but if it's diagnosed in pregnancy, then it's gestational diabetes. Effects of maternal health that gestational diabetes testing has. Early testing, there are perinatal effects of early testing, that there are perinatal effects of, I'm sorry, um, perinatal effects would include macrosomia or traumatic birth experience. Sometimes a shoulder dystocia may cause experience for the mom, fetal intolerance of labor. There's also postpartum effects after delivery. A woman she may develop gestational diabetes in later pregnancies or develop type 2 diabetes later in life, or insulin resistance, metabolic syndrome, increased risk of chronic hypertension, and others. Some screening variables that are used in order to decide if a mom needs to be screened early or not. Normally, routine testing takes place between 24 and 28 weeks of gestation with a 1-hour glucose tolerance test. And if that test becomes with the result, then the patient will go through a 3-hour gestational tolerance test. And so some factors that would cause a doctor or midwife to decide to test a woman at her first prenatal visit or have early testing would some such as chronic hypertension or history of preeclampsia before in previous pregnancies, or gestational diabetes in a previous pregnancy. But the most common obesity that we would test early for gestational diabetes. There are some benefits of early glucose tolerance testing. The discussion is ongoing. One thing for sure is better management of glucose throughout the pregnancy. The blood glucose levels will be more tightly controlled. Generally, if you're tested early and we find that you have diabetes earlier in pregnancy, decreased patients. Well, if you are early tested, then you can control things better and you control your glucose better, and then decreased. Some levels of treatment when a woman is diagnosed with gestational diabetes, diet and exercise is the first thing that we try to monitor, and we monitor very closely blood glucose levels. That is not proven to help levels. Then we move on to oral medications such as metformin, in that family. And then if that doesn't control the blood glucose well, then we would move on to insulin. Some obstetrical outcomes, if early glucose testing and we find a woman has gestational diabetes earlier, and it allows for us to begin to treat her earlier and therefore control her glucose levels better. The glucose levels are controlled throughout the pregnancy, then your risks for complications are decreased, and therefore have those problems with the traumatic deliveries and things like that. Perinatal outcomes are decreases in likelihood of poor infant feeding. After delivery, infants getting their blood glucose checked a lot, and they won't feed well, or you decrease the risk of birth injuries and you increase delivery experiences for these moms. These are my references, and I would like to mention, I do want to say, let me finish here. We'll go back. I would like to say thank you for taking the time to listen to me today about gestational diabetes and timing of testing. The conclusion is that as to women earlier if they have higher risks, and truth be told, there's no real difference in the outcomes of the infants and mothers early, but even though there's no outcomes, even though the outcomes are not different, the experience for the mother is different. And so if you have any questions, please let us know. Appreciate you listening to me today. Thank you. Have a good day.